Happy Thursday, everybody. My name is Darlene Merkler, and I'm with Inland Caregiver Resource Center. I am on Facebook Live at this location every Tuesday and Thursday at noon, and I share 15-minute tips for family caregivers. And each week we have a different topic. This week we are talking about the dementias. And on Tuesday, I talked about what the description of dementia is, and we talked about the three areas that are affected by dementia, which I'll just quickly review. Was cognitive. We went into more detail about it, but the cognitive area, psychiatric and behavioral problems, and the activities of daily living. We also talked about Alzheimer's disease, the symptoms and so forth, vascular dementia, and Huntington's disease. So today I want to continue our discussion about the dementias, and I want to start off by talking about Parkinson's disease. I did want to mention that if you missed Tuesday's presentation, I'm very excited that all of our Facebook Live presentations will now be available on our YouTube channel, which is Inland Caregiver Resource Center. And I posted many of the videos that we've already done on there already. So Tuesday's presentation about the first part of the dementias is already posted on our YouTube channel. So I would love it if you would go to our YouTube channel and subscribe to it, and that way you'll get notified when new material is posted there. And our Spanish and English Facebook Live presentations will be posted there from now on, which is a great resource for caregivers because as a caregiver, you may not always be available right at noon on Tuesday or Thursday. So this way, if you missed the live presentation, you can always go to YouTube at your convenience and look for the topic that's of most interest to you and watch the little 15-minute video. So let's continue. Since I only have 15 minutes, I wanted to start off today by talking about Parkinson's disease. I think many of you have heard of that before. And we actually at Inland Caregiver Resource Center have a Parkinson's support group. We have 12 family caregiver support groups, and one of them is specific to Parkinson's disease. I have posted the schedule of all of our support groups on Facebook before, but this specific one is the second Thursday of the month. And next week, we're very excited because we have a special guest speaker who's a physical therapist from Ballard Rehab, and she's going to be talking about a program. I believe the acronym is LVST. It's a specific physical therapy program for people with Parkinson's disease. So if you know someone who could benefit from that, have them call our office so that they can attend the support group next week, because you do have to register for that since it's on Zoom. So Parkinson's disease, remember on Tuesday we talked about the cortical and the subcortical. Parkinson's disease is in the subcortical part of the brain, and it's a progressive disorder of the central nervous system. One of the symptoms that most people connect with Parkinson's disease is the involuntary body movements. So there's my little girl. Chloe, stop barking. So that's one of the symptoms. People with Parkinson's disease also lack the substance dopamine, which is important for the central nervous system to control muscle activity. So that's what causes the involuntary body movements. The symptoms are often characterized by tremors, stiffness in limbs and joints, speech impediment, and difficulty in initiating physical movement. That is one of the main characteristics of Parkinson's disease. Another type of dementia is called normal pressure hydrocephalus. You might have heard of this before. It includes dementia, urinary incontinence, and difficulty in walking. It's really it says here, an uncommon disorder which involves an obstruction in the normal flow of a cerebral spinal fluid. This blockage causes a buildup of fluid on the brain. I remember when I worked in an Alzheimer's assisted living, one of our residents there had this. She also had another form of dementia as well. But she went to the hospital, and they can drain that fluid out when the pressure builds up. And when she came back, she still had some confusion because of the other type of dementia that she had, but her behaviors and her symptoms were much improved. So that's one good thing, is that some of the fluid can be drained off. So and it's usually caused by several factors, including meningitis, encephalitis, and head injuries. So in addition to the treatment of the underlying cause, the condition may be corrected by a procedure where they insert this shunt and divert the fluid away from the brain. That's what this lady had done, and it really helped a lot. The next type of dementia that I want to talk about is, and I'm probably not going to pronounce this right, but it's Creutzfeldt-Jakob disease. And that is a type of dementia that you don't hear about a whole lot, or you might hear about it under a different term. And this affects the cortical, it's a cortical dementia, so it affects the cortical part of the brain. And there are three, the acronym for it is CID, so I'm going to use that instead of trying to pronounce it. But there are three main types of CJD: sporadic, familial, and infectious. So 85% of the cases are sporadic with no known cause. So familial cases account for 10 to 15%. In other words, it's a genetic, and are genetically passed on to family members. The remaining cases are infectious, resulting from exposure to an external source of an abnormal protein, such as in BSE. This is unusual. You don't hear this very often, but dementia in children, it can happen. Though rare, there are some disorders that cause the disease in pediatric patients, including Pick's disease, Batten disease, Lafora body disease, and certain types of poisonings. So just know that that is something that can happen. What other conditions can cause dementia? So there are many. Low oxygen in the blood, either from a specific incident like a heart attack, a stroke, or surgical complications. And I do know about the surgical complications. My friend's father had surgery, and he was in his late 70s, and when he came out of the surgery, he did have some mild dementia, and they attributed it to the lack of oxygen during surgery. So also it can be a chronic disease that causes it, like heart disease, asthma, or COPD, or emphysema. It can also cause damage to the brain tissue. An acute infection like meningitis or encephalitis, untreated, syphilis, and Lyme disease can also cause dementia. Of course, brain tumors, which someone was asking a question, is there age for the children? It did not, in the article that I got this information from, did not say any specific age, but it did show a picture of a toddler like 2 years old. So I'm thinking any age child, if they had those conditions that I mentioned, could possibly have some dementia. Brain tumors, which I've talked about before, can cause dementia. And many times, if the brain tumor is removed, then the dementia goes away. That's not always the case, but in the more positive outcomes, that is the case. Also, I've talked on here before about vitamin B deficiency. B1, B6, and B12 are very common in our senior population. because especially seniors who live alone, they don't hydrate enough. I carried this around with me all day to try to get 2 or 3 of these in every day. Hydration is critical for all of us, but in older adults, severe dehydration can cause dementia-like symptoms. Of course, hopefully it is reversible in that case. Also, traumatic injury to the brain, like hematoma, something like that can cause dementia. Some of these are reversible. Side effects or medications. We all know that all medications have side effects. And what's the most common side effect you see on a medication bottle? Disorientation, confusion, and so it may appear as though the person has dementia. I've oftentimes said to family caregivers, if your loved one suddenly starts showing confusion or dementia and they didn't have it before, and they just started a new medication, there could definitely be a correlation there. So you want to check on that. So, poisoning such as exposure to lead and other heavy metals, alcohol, recreational drugs, or other poisonous substances can also cause dementia symptoms. Not all conditions are dementia. Some things look like dementia. For instance, depression. If any of you were in my workshop about is it normal aging or dementia, I talked about in the early stages of dementia, the person many times becomes withdrawn. And so many times the dementia is not diagnosed in the early stages, because in the early stages the symptoms look very similar to things that may happen as a normal part of aging. So and depression is more common in older adults than people talk about. I don't think even doctors are tuned into that when they're seeing an elderly patient. But dementia is depression is something that can happen just as a normal part of aging. You may lose your spouse, you may lose many of your friends, you're not as active as you used to be, you have a lot of pain perhaps. And so all those things contribute to the depression. And for the 7 years that I worked in Alzheimer's assisted living, one of the things that I noticed is when we would evaluate all the medications when a patient would come to live with us, and if we sense that the person was depressed, and depression and the early signs of dementia look very similar, but if in the cases where the depression was addressed, then it looked as though the dementia was getting better, but actually they were addressing the depression part of it. So many times people think when someone is depressed they may have dementia, and vice versa. Also delirium, age-related cognitive decline. We talked about B12 deficiency, and also reactions to medications. So I just have 2 more minutes. I just want to quickly talk about what are the risk factors for dementia. Of course, age. The older you get, the higher your risk of getting some form of dementia is. Doesn't mean that everybody's going to, but after age 85, about 50% of us will have some kind of cognitive issues. Could be just mild cognitive impairment or confusion just because of normal aging, or it could be a form of dementia. Also, genetic and family history. Researchers have discovered a number of genes that increase the risk of developing Alzheimer's. So if you have Alzheimer's or dementia in your family, please stay on top of that and get that checked out. Smoking and alcohol use. Of course, we've always heard that that's bad for us, but studies found that smoking significantly increases the risk of mental decline and dementia. And people who smoke have a higher risk of vascular disease, and we've talked about vascular dementia, so that's a risk also. And cholesterol, high cholesterol can increase a person's risk of developing vascular dementia. Diabetes is a risk factor for both Alzheimer's disease and vascular dementia. Mild cognitive impairment, or MCI, which I just mentioned, while not all people with this condition develop full-blown dementia, they do have a significantly increased risk of dementia compared to the rest of the population. So, geez, I would also Down syndrome is a risk, and I wish I could go into more information. I'm really passionate about Alzheimer's and dementia. So I want to answer this one question someone asked: Is dementia hereditary? And I think I just talked about that a little bit. But if you have Alzheimer's or dementia in your family, it does not necessarily mean that you are going to get it, but your risk is higher. And so that's why it's important to practice good brain health. And we've talked about that before. Eating lots of good antioxidants like blueberries and dark green leafy vegetables. Keeping your brain healthy. There's tons of information on the internet. I would recommend the Alzheimer's website, alz.org, and look under brain health, and they will give you lots of tips on keeping your brain healthy. Your risk is higher if it is in your family. So I want to close out right now because I'm over my 15 minutes, but I just want to remind you, in case you weren't here in the beginning, that all of our Facebook Live 15-minute videos are now uploaded to our YouTube channel, which is Inland Caregiver Resource Center. So please visit us there. You can look at all of our videos there in case you miss them here, but I also love seeing you here live on Tuesdays and Thursdays at noon. So I hope you have a great weekend, and I look forward to seeing you next week. Bye, everybody.